Figuring out what model works best for given stakeholders in a given market requires an initial analysis. All of the models, whether it's bundled savings, whether it's shared savings, whether it's population health, all of them can be beneficial. Many of them have significant disadvantages, and many of them are somewhat time limited. And when they're time limited, you can see some success for 2 or 3 years, and then the program starts to slip backwards unless you have the next step on the ladder to walk onto. And so ultimately what we like to do is figure out where in the transition of stakeholder alignment is a particular market. Based on that, we may start with bundled payments. It's a good way to get stakeholders aligned, but it is certainly not the best way to save large amounts of money. If, for example, you look at back pain as a diagnosis, only about 10% of the spend for back pain treatment is for surgery. So doing bundled payments around a limited number of surgeries, even saving 20%, which is a very high number in a bundle, even saving 20% in spine bundles is going to be less than a 2% impact on the total cost of care for low back pain. But by engaging the entire market in diagnosis-based population health, where we're taking risk as a market for any claims, 26,000 ICD-10 codes, 30% of the world of ICD-10 codes, we're bouncing that off a risk pool. Facilities are covered, orthopedic procedures are covered, therapists, PCPs, emergency department care, really everything but outpatient pharmacy falls into this huge bucket, which for, say, a Medicare Advantage plan is perhaps the fastest growing year-over-year trend in spend and could equal 20+% of the total premium spend. Ultimately, those are the models that we focus on. And in order to be successful in those models, you need to really do 3 things. You need to align stakeholders, you need to have made big investments into proprietary tools, data resources, and infrastructure, and you have to have a very sophisticated team that is able to function well at the highest level in all of the different functional areas and verticals within the musculoskeletal spend. And so HOPCo, for example, is one of the largest convener of bundled payments in the country. We have invested $100 million in this proprietary platform and infrastructure. And we have a team of over 1,500 folks that have done nothing and do nothing except excel in their functional area in the musculoskeletal space. And so by combining sort of these 3 legs of the proverbial stool, we can enter a market, align the stakeholders, and together as a team, we can all win together.